Yes, it's a tire shop.
Okay, we'll go ahead and call the meeting of the Employee Benefits Review Committee to order at this time. Lisa, will you please call it?
Sir. Councilmember Blevins.
Here.
Member Marlowe.
Here.
Member Freitas.
Here.
Member Holloman. Here. Member Claxton.
Here.
Member Valad.
Here.
Member Doe.
Here.
Councilmember Feldhouse.
Here.
Everybody's here.
Second, ma'am. Now we'd like to ask for approval of the agenda. Chair will entertain a motion.
I'll make that motion.
Have a motion to have
Second.
second. All in favor, state saying aye. Any opposed, nay? Motion passed. Public comments. Do we have any comments from the public? All right, we'll move right on into our old business, which is the TML presentation by Tim. Kevin, do you want to introduce your team?
Does anyone have a booklet for you, Sully?
Yes.
Everybody got one?
Yes. Well, thank you, Mr. Chairman, members of the review committee. Once again, Kevin Krasinski and Tim Langford with the Tennessee Municipal League. Thank you for giving us the opportunity to come back before the group today. We're very grateful for the chance to present these numbers and you guys giving us the opportunity to refine everything. So I really briefly am going to go through this and then I'll introduce our partners that I brought with us today. But the booklet has largely unchanged since the last time we visited, but we did add a few extra pages as you provided us the time to develop a refined quote. So I'm going to skip forward a couple pages to our strategy one that we talked about before, which is the group coverage using a gap product that's proprietary for TML membership, the city of Shelbyville, of course, being a TML member, and how we are using that as a strategy, as a win-win for both the employer, being Shelbyville, and also the employees. So that what that gap coverage allows us to do is to find a different plan where we can raise the deductible from your main carrier, being Blue Cross Blue Shield, and then use a supplemental carrier to fill in that gap. And they're able to do it at a much better rate than what we can buy commercially. So if you skip forward, probably 2 more pages, Kate, I think. So that's just the brief description of that Gap Medical. Zurich, of course, being the provider that's created this product for TML membership. And then on the next slide, you'll see kind of what the concept entails. So, there's a variety of ways, of course, that you can fund as a municipality or any employer. And the first one being you could be fully insured. This is looking at commercial insurance side. But if you're fully insured, of course, you've defined a deductible. And then the insurance, that's the employee share, and then the insurance company picks up the rest of it. What a number of cities have done and what we've seen across the state is this idea of a split funded, where the city picks up a portion, the employee picks up a portion. They've raised the deductible so that the insurance carrier's amount is a lot lower. So that's that middle column. So what we've been able to do is work with a supplemental insurer to provide better rates for everybody, where we can buy down that deductible. So you see the blue share, the employee share on that chart. It can go as low as $500 if you want. And then this gap coverage will pick up that increment that allows us to raise that deductible for your main carrier, your major medical carrier, up to a higher amount. And that saves everybody money. So what we have developed, of course, in this league partnership is working with a group that has a long-term experience. As I mentioned, FMIG Health has been working in specifically employee benefits and carrier relationships for over 25 years. So they have helped us with the benefit design product, and they're also the carrier interface for us. Derek Jenkins and Kristen are with me today, behind me on my right and my left, and they are going to be kind of our interface with claims relationship, carrier relationship, and also helping all the employees understand the benefits that they do have. So at this point, I would love to turn it over to him unless you have any general questions, and I want to be mindful and respectful of your time, of course. So if there are any specific general questions, I'd be happy to answer those right now. Otherwise, I'll turn it over to Derek to get into the nuts and bolts, the numbers. I'm glad I bought some people a lot smarter with me today than I am.
Any questions? Thank you.
Thank you.
Thank you.
Again, my name is Derek, last name is Jenkins, and when he mentions the 25 years, I actually founded First Mutual. And I guess when we talk about dealing with health insurance companies in 25 years, I don't know how many years that would be in dog years, but I look like I'm 105 years old because my job is actually to protect the employees when it comes to making sure that they get what they're entitled to from these insurance companies. And on a personal note, before we jump into all these different numbers, every employee is going to have a one-on-one consultation with a benefit counselor. The reason we do that isn't to just make sure they know what they're purchasing and how their plan works, but we want to develop a relationship because I've been on both sides of the equation. In 2008, I lost my high school sweetheart wife that we had 4 children together. In 2008, at 33 years old, she was diagnosed and passed away with cancer. And so I've seen exactly how important a health insurance card can be. Nobody wants to talk about it, but it's the first thing you reach for. If you're ever sitting across from a doctor, you get the worst news in the world. And we want to be the personal relationship behind that insurance card because I can ask most people on the street, like, what would happen if you woke up in the hospital tomorrow? Most people have no idea what their deductible, what their out-of-pocket responsibilities are. You guys have your lives to live. Having a personal relationship with your benefit counselor is where we can come in and we can organize not just the medical insurance, but the dental, the supplements. We want to know how everything works together so an employee has one point of contact. We can really kind of walk them through that. A lot of times we'll come into a city and we'll see that there's 3 or 4 or 5 different companies that are involved, but nobody knows who to turn to. If they have Aflac on one thing, Colonial on another, or Liberty on it. So we try to come in and take a comprehensive approach at everything that the city's doing, clean it up, and make it easier to administer for the town and city, but also make it very simple to have one point of contact for the employees. And just coordinating all of that is, I think, where we try to start, making it all simple. When we're looking at, would you mind going back to these arrows, the arrow thing here? One of the things that when we looked at these 3 different options, that split-funded HRA buy-down has been something that's been really popular. But what we don't necessarily like about that is that when we raise the deductible, and now the municipality is sharing or self-insuring against those costs, that's what these arrows mean. That HRA is actually money that the city has to set aside, and it's an unknown. We don't know how much the city might hit, and so that seems to be one of the biggest problems that we've seen when municipalities have tried that, is that they know what the worst case scenario budget is, but it's a moving target. We don't know if we're going to have a COVID year or if we're going to have a good year, but either way, it can be an unpredictable amount. The most important thing about the split funded with the gap is that the insurance premium is a fixed cost. We don't have to worry about the variables, and it's pennies on the dollar to have an insurance product, remove that risk from the city. And so that's why when you see these numbers, they're going to look a little too good to be true, but it's because we have the TML's buying power to go in and negotiate with Zurich. And we didn't look at each city on its own. We took the TML's association as a whole, and that's how they put this product together. Really important on this when we go through all these numbers. I don't want to get lost in the numbers and lose the real benefit of what we're trying to do. When we set this up, what we looked at initially was that you guys were doing a very traditional type of approach on the health insurance, but every year there's one thing that's for certain, and part of the reason why I look so old is that the rates are going to go up. And the only counterbalance we have to that is to raise our deductible to try and keep the rates somewhat under control. And when those deductibles start to go up, and you guys have a relatively low deductible, but my guess is that if your rate continues to go up, it's going to put pressure on you guys to try and keep that deductible down. And right now, when I looked at your plan, the costs were $804 for an individual, all the way up to $2,439 for a family. When we calculated that out, that's about $245,000 a month, almost $3 million a year. And those costs are actually pretty competitive compared to what other people are doing, but it doesn't mean it's the best way. We looked at the copays, and whoever designed the plan did an amazing job trying to keep the copays in place on the little stuff. If you look at the minor medical, where you see preventative care, telemedicine, doctor visits, specialist prescriptions, these copays aren't as low as they were 10 years ago, but they're still relatively low when you're looking at them. On the major medical, if you look at this 2,000, that's actually the annual deductible for the employee. The 20% is what we call coinsurance. That's the percentage after that deductible is met that's responsible to the patient. And the 4,000 is the out-of-pocket maximum. So if you had an employee that had a serious accident or, God forbid, a serious illness, that would mean that as much as you guys are paying for this premium, it still leaves the employee with about $4,000 out of pocket. That's real bills sitting on the kitchen table while they are trying to put their life back together. So again, I think when we look at this, this was not a bad plan, but the TML gap product allows for us to change these benefits around just a little bit, and at the same time save the municipality a pretty considerable amount that may be able to be redirected to providing more supplemental coverages for these employees like disability, those kind of things. So if you look at the difference in rate on the second column, this is the proposal we're putting together, and it's 737 versus 804. So it's actually considerably less. The family goes down from 24 down to 21, and the overall city saves $260,000 in the first year. That's about an 8.87% savings. Now, one of the things that we also noticed about your plan is that you have an anniversary date. I believe it's in July. Is that right? So having an anniversary date in July, but having a calendar year deductible that resets in
Check with
January.
English unless you switch languages. But hey, try me whatever you want.
Sorry.
We were just giving him a compliment. I have a curse, by the way, if I give you a compliment. But what we looked at was trying to actually bring those two things together. So our anniversary date and our calendar year deductible come together is something that could be a big benefit, because what we've seen in the past is, again, if Blue Cross raises your rate 8 to 10% next year, and the only course of action we would have under your current structure would be to raise the deductible. What happens is when you raise your deductible in July, that means that new deductible takes effect in July, and from July to January, until December, I should say, those folks that thought they'd already satisfied the deductible are going to get hit with potentially that change that might have to be made in order to keep the rates down. It may or may not happen, but I can tell you that it's happened enough that if we can coordinate the effective date of your anniversary date with your calendar year deductible, it avoids any mid-year changes that could cause confusion for the employees or potentially higher out-of-pockets than they expected. Does that make sense the way I explained that?
Yes.
Okay. And I was just going to say one other thing here. I didn't realize you were the fire chief, but I shook your hand earlier. If I'm ever in a fire, I think you could pick me up with one arm. So I was like, oh, I shook his hand. I was like, oh, wow, this guy knows how to shake a hand. So in any event.
That's his best quality.
All right. So what we tried to do with the GAP plan is we're always going to try and make sure that we're not hurting the employees on the day-to-day co-pays. So the preventative care stays the same. The telemedicine stays the same. The doctor visits a specialist went up just a little bit. Unfortunately, we couldn't do it much better than that. But this plan that we're doing, just so you know, as Kevin mentioned, your current policy has this $2,000 deductible up to $4,000 out of pocket. This plan that we're switching to, at the core, before we have the Part B TML, what we've done is we've taken our $2,000 deductible. If you look at the top of that column, you'll see we raised the deductible up to $6,350. Okay, and the 80/20 is still there, but our out-of-pocket total is $10,600. So what do you think that did to our cost of our Blue Cross plan when we raised our deductible to such a high level? It dropped the cost so considerably that now we can layer in the Part B coverage that the TML is designed, and we cover up that $6,350, and we drop that deductible down to $1,000. If you go down to the major medical, where you see outpatient testing, surgeries, instead of having a $2,000 deductible, 80/20 coverage to $4,000, you have a $1,000 deductible on those really serious claims, and then there's 100% coverage after your $1,000. which means that your total year, if somebody had a heart attack, cancer, had an accident, whatever it might be, instead of $4,000 in risk, we're down to 1,000. If you have a family, that 4,000 goes to 8,000. On your current plan structure, we go down to 2,000. So in the end, it's conveying over to not just the employee, but to their family members. If there's more than 2 people that get sick, the third person beyond is free because we cap the family risk in that scenario. So in the end, that's why I never mind getting up and talking about benefits if I can offer a lower cost to the city and talk to your employees about having a lower total out of pocket in a bad year. That makes my job a little bit easier. If I had to come in and talk about raising deductibles and costs at the same time, that's a hard thing for us to do. So when we came out and talked to the TML, that was really our primary focus, is how can we do both? Get the costs under control for you guys. Now, by raising that deductible up, here's a quick question for you. But if Blue Cross gives me a rate increase on $804, and let's just say it's a 10% rate increase, that's like $1,000 per employee that just went up. That's crippling without having to raise the deductible. But because we've raised our deductible so high with Blue Cross, we're starting with a much lower base cost. We're in like the 400 to 500 range. And so now if I take a 10% increase, we just minimize the effect of that. It doesn't mean we can't still go in and look for alternatives, but I wanted to let you guys know that these compounding annual increases, by getting our overall base costs lower, it'll help us create more stability, not just today, but in the long future. The Zurich policy that TML has, that one is a fixed rate. It doesn't go up. And benefits, if we raise the deductible, we can kind of play with that a little bit, but go ahead.
I think you already answered it in what you just said, but that 737.87 number, that's a combined premium
Yes.
of the Blue Cross and Zurich together.
That's including, when you see the check mark on the TML Gap Medical,
Yeah.
that is including it. So when we have a base cost of about 500, and now we're adding that TML, that's a high quality plan that's going to help reduce the copays at the doctor, but most importantly, reduce the that overall out of pocket. And I don't know how often people get sick, but when you have 230 employees, there's a percentage that there's going to be five people, just looking at industry standards, that are going to hit that deductible, and they're going to be very happy if they saved $3,000 in potential risk. Now the savings that's created, that 260,000. There are some things that you can do. I have voluntary benefits. Now, whatever you guys are doing now, I know there may be some things that you guys are sponsoring now for the employees. Do you guys sponsor, I believe, the dental for employees? Is there any other benefits that you guys are sponsoring now? And you may have provided this information, but
Life insurance and disability,
okay.
employee dental and vision is 100% paid for.
Okay.
I think the life insurance is what, 45,000 Alicia?
Yes.
That's great employees.
So what we were hoping is that if we put more money towards the ability for you guys to improve or enhance some of those benefits with found money, that's our goal, or just make the bottom line for the city. Whatever you guys decide, my job is to come in and hopefully free up some money that we're losing right now to Blue Cross. When it comes to administration, are you guys using now like an employee navigator, or is there a pretty fancy system that you guys have for doing that? So that's something we also provide. In addition to trying to make sure that there's one point of contact for the employees, we try to create one point of contact for you guys as well. So we'll try to consolidate as many of these benefits with our primary carriers as we can. So you're not writing out 15 different checks, trying to keep up with employee rosters with all these different moving parts. A lot of times we can make that easier. And then we give you the technology and the training to make it all on one simple platform that allows for you to go in and click a button, and it'll communicate to our team that you've had a new hire or termination. We audit your account every month as well to make sure that if you guys are doing that now, you have an extra source of extra resource for that. That's all provided free of charge. It's something that we do. So I think ultimately that I've been doing this for so many years, and whether it's the Captain D's franchises that we take care of, or some chickens, we're in the private as well as the public sector, but I know where a lot of the pain points are. And some of it's obviously going to be on the employee side, some of it's going to be budget-wise for the city, but it's also the administrators. We try to make sure we provide you guys systems to make it something where if you're sick a day, somebody else can come in and take care of that. system with you.
I have a question, just to
Sure,
clarify,
go ahead.
on where it talks about major medical, when you have the emergency room, the copay we have now is 200,
Yes.
and then the proposed plan has 1,000, 0, and 1,000. So is that each and every time you go to the emergency room, or is
No.
1,000
The
for?
200 is each and every time.
Right.
So I'm really glad you brought this up because there's two things on here, really three areas where we couldn't reduce the risk to the employee. One is specialists. We go from 50 to 75. On urgent care, it goes from 50 to 130. An emergency room goes from 200. And instead of a $200 copay each time, we count that towards your major medical deductible. What most people don't realize, if you go to the emergency room and they do services outside of just the emergency room copay itself, if they start running tests that are outpatient or you start having surgeries, things along those lines, your major medical deductible could come in and be on top of that copay. And so when you look at that 2,000, if you get admitted through the emergency room, you're paying the $200 copay, but then you could also have deductible co-insurance, and that 4,000 could be a real number. Now, if anybody's ever gone to the emergency room, it's not likely you're going to walk out with less than a $10,000 bill if it's something serious. And so hitting those numbers, we'd rather it be capped not only for that 1,000, but now for the rest of the year, any other major medical claims you have are covered at 100%. The one downside is that you still would have copays because the copays are treated separate of your major medical deductible, but any other outpatient testing, surgeries, emergency rooms, even your urgent care is actually covered after 1,000. Although there's a $130 copay, that does count on your major medical against your $1,000 deductible. So the only copays that we would still have would be on the minor medical side. Quite frankly, minor medical copays aren't going to bankrupt somebody, but a $4,000 bill, it's not going to bankrupt them, but it's going to be a real challenge sometimes for people to find that extra money in their budget with inflation where it is. So we try to always come in. Now, the copay on regular doctors is actually less, and I think that's probably the most common usage on this. And instead of 35, we go down to 10. So I felt like that was a positive for most employees as far as the day-to-day usage. But the prescriptions are actually very similar as we're still using Blue Cross. The one thing I wanted to make sure was really clear is just we try to minimize the disruption. And so people that are already on Blue Cross and know their doctors take it, they know that they're good to go in. We're not changing your major medical. We're just going to now have a supplement, and anything that Blue Cross covers is covered by the supplemental. There's no pre-existing conditions. There's no, oh, they don't cover this or they don't cover that. Anything that Blue Cross covers, Zurich has a contract to cover everything that would normally go to the deductible. So there's no additional moving parts there. There's no network to worry about. It's all tied directly to the Blue Cross plan. So anything Blue Cross pays, Zurich will cover to help protect that deductible risk.
Can you talk a little bit more about this top number, the 6,350?
Sure.
And the 10,600. I feel like there's almost like a need for a third column that represents what Zurich is actually doing. So I understand that that's the new copay because the gap is taking the lion's share of that 6,350.
Yeah.
But what is that lion's share? Where is it?
So
500 is what we're.
Yeah, basically the number that you're looking at is the 10,600.
Uh-huh.
So what Zurich is doing is they're basically going to have a $1,000 deductible, but they're giving a $9,600 benefit to every employee. And that 9,600 is where we're basically eliminating the out-of-pocket from that 10,000. So all these other moving parts, the 6,350, the 80/20, Zurich is coming in and cleaning all that up and saying, you pay the first 1,000, we got you covered for everything else. So the benefit from Zurich is a $9,600. Yeah, so it's like having a savings account that Zurich has put it. It's like you already have that $9,600 difference between the $1,000 deductible and that total out of pocket. Zurich's cleaning it all up. So there's no moving parts to it. There's no 80/20s. Zurich is just going to put it right on their card, and we'll show you the card in just a minute.
So the real number is 1,000 as opposed to what we are right now, which is 2,000.
That's
That's
exactly
the
right.
real number.
The 2,000 is just the deductible on your current plan. If you actually went into the hospital, you'd have the first 2,000. Then the insurance company begins to pay 80%, but you're responsible for 20%.
Yeah.
This is where all the confusion comes in because people don't know well, what was covered under this, what was covered under that? And that's why we have Kristen here, because she's our service manager that handles every large claim. We'll talk to Kristen. We'll make sure that they are 100% clear on it. But it's also a situation there that your total out of pocket on your current plan doesn't stop until you reach 4,000 out of pocket. So we're cutting that deductible immediately in half. But then we're taking all those other moving parts away, and it's all 100% coverage, and there's no claim forms. As soon as your employee shows that secondary card, everything's handled directly by the provider. It's all coordinated between Blue Cross and Zurich, and then the employee is basically going to they may still get those bills, but they're going to see that the explanation of benefits is also covering everything for them. And that can still be confusing. That's why we have Kristen and her team. They're there anytime we know that someone's hit their deductible. She's
Okay.
on the phone.
So this actually sounds like better than what we currently have,
That's what we were shooting for
Okay.
sure. Yeah.
better than what we currently have, and saving $250,000 doing it.
That's why I'm not in a cold sweat talking about health insurance and benefits.
So usually you don't get more for less.
Right.
So my question to you is what's the downside?
That's why we're excited about it. In all sincerity, when I come in and I let you know, and I tried to explain it as best I could with the fact that right now you're trying to get the best deal you can out of just Blue Cross itself. But it's impossible for Blue Cross to lower your deductible the way we're doing it with the TML plan. So this gap product is the big difference maker. When we went to Zurich, just so you know, they took the TML and all of the association members that they have, I think that's about 99% of the municipalities. I was able to go to a carrier partner I'd worked with for 15 years, and I said, I think we have a very special opportunity. Can we start with this buying power and use their association to help these municipalities get this product on the table? And that's really all they did. And Zurich, if you're not familiar, they're one of the largest insurance companies in the world.
On like an individual, it's $1,000 out of pocket, does that still double, or $1,000 deductible, does that still double, would be 2,000 out of pocket?
That's
for
your
the
worst case
year?
scenario.
That's
Right
an
now,
individual.
your out of pocket would be 8,000 if you just have Blue Cross providing what you have right now, this fully insured plan. This is called a split funded policy. And so it's not new, but the rate that we were able to negotiate on that gap plan is what's exciting. Because these are normally much more expensive, but because of the buying power of the TML, when we put those number of lives together, it allowed for me to go in and negotiate. And now I have to deliver, and I have to be able to explain all of this, but in the end, that's the beauty of it, is that we can eliminate that risk that you're seeing in that 6,350, I mean, $10,600 out of pocket, you can see how we dropped the rate. Because we're going from right now 4,000 to 10,600. The way insurance works is if you're willing to take more risk, they're going to lower your premium. Right now, we're kind of here. And so I'm just basically trying to level the playing field by raising the deductible of Blue Cross and taking that savings and using that to include this gap plan. Now, the 1,000 that we see here, you can go down to 500. You can go up to 2,500. But the 1,000 is the most popular because it's not that big of a difference in cost to do the 2,500 versus the 1,000. The 500, it's a little more administration for us because more people are going to hit a $500 deductible. So the 1,000 ends up being kind of the sweet spot. We don't want people to overuse or abuse the plan. So the 1,000 tends to be something that's easier for us to manage the long term.
Oh, if I may do share a quick interjection. So, one, I guess, financially, the downside of this, of course, is on the paper. It's there, there's little to no financial downside. It's better for the employee. It's better for the city. The only hiccup we have come across is some providers are unfamiliar with someone carrying two cards. So the employee will have to carry two cards where they go. They submit both cards, and the claims processed for both carriers. There are providers we've come across that are unfamiliar with this practice, so it's a little bit of they question the employee, or they want the money, but Kristen's working behind the scene, that's why we got her. She is going to make sure that everything is rectified, that the employee is whole, that the providers are taken care of, and usually after a couple of weeks of unfamiliarity, everybody becomes educated and everybody understands this is just another form of the insurance.
And are you planning on having some sort of, I'm sorry, go ahead, it's, Bob.
But, hey, Lisa, true.
To make sure I'm clear. Sure. On the numbers that you have, you have our numbers at 804.25 for an individual,
Yes.
and yours at 737.87.
Yes.
To make sure we're comparing apples to apples, does yours include vision and dental?
No.
So ours does, okay?
It's the 804.
I don't think it's in the folder.
It's not in the 804.
No, we
It's
can
not.
isolate just the cost of medical at this point. I'll talk a little bit about the dental and vision that the TML has.
Okay.
But, you know, at this point, we were just trying to look at the actual cost savings, apples to apples as best we could.
Okay. I thought that was it.
Okay.
To follow up on what Lisa asked, if you're an employee only, you only have single coverage,
Right.
or is your out-of-pocket $1,000?
$1,000.
Okay, 'cause I think you
After
said
1,000, it's
2,000.
100%.
No, I thought it was 2,000.
That's if you have
Oh,
family,
if you have
right?
a family, yeah, so what happens if you have a family, then you have your current plan, if both people had major medical claims, you could have up to 8,000.
So it's just me by myself, it's just me by myself.
1,000.
So no matter what I have occur in the whole year, all I'm gonna pay is $1,000.
On major medical, the only other cost you would have would be the co-pays on the minor stuff.
Okay.
But on your major medical section, $1,000 out of pocket, 100% after that.
And then on the minor medical, it's 1,000 and 20, okay.
Just a moment, okay. We will get to you. I promise.
My secondary question was, talking to Kevin about the, providers giving you a hard time having your card. Have you had any occurrences of providers refusing to file that secondary insurance claim, where you had to do it yourself?
I can answer that. When we've had employees not have the card on them because they forget and they pay the copay, we do have to, in many cases, Kristen will actually go in and all they have to do is send us a copy of the receipt and we get them the reimbursement. The reason that we sometimes have to get a copy of the receipt is that we want to make sure that we cut that off so that the provider isn't getting paid twice. We don't want the employee to pay and then have Zurich pay them as well. So we do our benefit counseling. We let them know that if for any reason the doctor doesn't take the secondary card and they force you to pay the full copay, send a copy of the receipt and within 10 business days, you'll have a refund. That difference. And that's
Lisa asked my follow-up question.
Good.
Yeah.
And so,
Yeah, go ahead.
All right, so I believe I heard you say earlier that with the gap insurance, the rates with them that are
that's
figured in here.
consistent. Yeah.
Yes, okay. So, and I also, you mentioned that they agreed to join in based off of the TML membership power.
Yeah, that's how we got the negotiated rate
Okay.
as low as we could.
So, devil's advocate here. What if this new venture that is going on does not meet the expectations and the hopes that you feel? And say 2 years down the road, Zurich is like, we can't do this.
They sell.
Will they drop? Will they raise tremendous? I mean,
Right.
would that affect this
It's a great
737?
question.
You know,
Yeah.
could it just really flip everybody upside down that has joined?
Yeah, it's a great question, and it is one that they agreed to these rates, and they don't just sell the TML. So this is one of the largest insurance companies in the world. I just happen to have a really good relationship with them.
Mhm.
My hope is that as we deliver, we might get lower rates.
Mhm.
Because at this point, they kind of came in and said, okay, Derek, we like you, but this is what we're going to do. If I start to deliver and we start getting into where we have tens of thousands of potential lives, don't think for a second I'm not going to twist their arm to say, what can we do better? How can we get rates lower? Because it's about buying power at this point. My reputation got us to the table in a situation there where we start exceeding those expectations. I think it only could get better from that. At this point, we came in with no enrollments and they agreed to do this. So I feel like already we've delivered on what they've asked for. And we just started this in July.
It's kind of a comment slash question to follow up on what Stacy just said. But I know that as long as I've been with the city, and I think other people back up, we've often been criticized when we compare city proper benefits versus other entities within the city, and the way their co-pays and insurance lines up. The reason that other people have, especially better, family plans and better co-pays is because they are in an association of like businesses that take care of utilities and those types of things. So to back up what they're saying, they have that collective buying power to negotiate. So based on what you said and what my understanding is, what we're paying now or what you're proposing now is based on what you're doing now. And my thought process is this gets before other committees and that is just going to grow. And very likely that we will have costs that would continue to drop as the pool gets bigger. Because we've had excellent representation and we've had excellent coverage, but our pool is only so big. So if we look back to some paperwork we got last time, and it showed increases by year. Okay, and if y'all remember, we had a few years ago, we had a really large increase. The biggest increase that whole span of time was in 1 year. That was because I had one employee that had one catastrophic incident. And that one catastrophic incident gave us a 13%, I think, and then that year, and then we had a 9% the next year, and then it kind of dropped back off. But this volume and the larger the pool is, which is what TML, and that's one thing you were talking about earlier about, hey, what's the downside? It's cooperative effort of cities to have a benefit of municipalities through TML that we would not have on our own. You know what I mean? And so I think it's, yeah. Because like I said, you're looking at numbers and hey, what does this mean? I think one of the most important numbers on this is that little, and you get down here at the bottom and when you got 1,000 on each side, it's that 0 in the middle versus the 20 over here. That's real money. That's real savings compared to everything else. That alone is it's the smallest number on this page, but that's probably the most important.
And to further, just one more second, do you know who's struggling the most? And this is just me kind of giving you a bigger picture, but these municipalities that have 10, 15, 20 employees, they get an issue like that where they have one of those folks get on, they get a 40% rate increase. So that is where the TML reached out to us about 2 years ago, and they said, we did a survey, and this is where these smaller towns and cities are really hurting. Now, if you have Memphis or Nashville, you got 12,000 employees, it may not be as big of an issue, but when you're dealing with you guys are actually pooling together with a lot of these other smaller municipalities. So I want you guys to know that was where the heart was behind all of this, is to take those 250 municipalities that have fewer than 50 employees and let's pool those guys together. And when we get a town like Shelbyville in there as well now we're strengthening our numbers. We're delivering even more than what Zurich was expecting. And so now you guys represent quite a few of those little towns and cities. That buying power is going to help spread it around so that those towns and cities will have the association membership power.
You told us last time you were here, the number of municipalities that you guys have signed on to date. What was that number again?
So we got four.
Mhm.
Yeah, we started in July.
We've got probably 6 to 8
Yeah.
between now and.
We find that most municipalities are like January or July. And we actually rolled this out with the town of Monterey. They were the first that started that. Did you guys see the numbers that we did for them? It was very similar.
I don't think so.
Yeah, so it was very similar. They had just taken about a 14% rate increase. The mayor had given out raises to everybody, but with that rate increase, it was going to be, okay, we're going to have to ask for more share from these employees. And so when we came in, we actually saved them about $82,000. So we helped them avoid that rate increase, and we did the same exact plan that you're seeing here. The only thing we did a $500 deductible. Yeah, we did a little lower deductible on there, but they were a good test case for us because when we talked about the doctors and that first month, maybe first 45 days, we had a lot of calls coming in saying, my doctor isn't familiar with how this works. So that's where Kristen, who has an extensive career in a doctor's office processing medical claims, she was able to make those calls personally. And over the last, I would say 5 or 6 months, it's been clear sailing. Now, one of the last thing I'll mention about the personal relationship, one of the gentlemen there had a wife who was passing away from cancer. So we were coming in trying to talk about changing health plans. The guy was following me around like a shadow. And I didn't know what his situation was, but I finally just kind of talked and engaged with him. And he said, my wife is in the final stages of leukemia, and I'm really nervous about how this is going to work. What I found out is that the agency that was handling it before, he had like different types of benefits that he had never gotten processed with his supplemental pet coverages. Like he had cancer. And so this guy was, I said, did any of these other benefits pay out? And he was like, no. So I put him at ease that we were going to take care of those situations for his wife, but we ended up giving him a $3,100 check already. And that's just the first round of things that we did, but we just got him a $3,100 check that he didn't, it was a kind of a situation where he wasn't computer savvy. That's his words, not mine. But we had the office administrator help him. We got those claims filed. I wasn't the agent of record on that, but to me, it's a sin that this poor guy's got a wife and he's, going through those situations and nobody cared enough to say, hey, let's see what other benefits we can get you. And so just so you know, it is a personal relationship for us. And I want to make sure you guys know that's where our heart is in this whole thing. I love the fact that the numbers work out. It makes my job really easy if I can come in and offer better benefits to the employees and substantial savings.
If we went with this and you matched up the calendar year end with our renewal, like top it off, when would we know each year what our rates would be? Would it be like November or like our renewal rates?
Yeah, so I was talking with the supervisors over at Blue Cross. What they said is they can't do the anniversary date for this January. You're already on a calendar year. So we would still have that renewal in July. They'll typically give us that rate 60 days in advance. If they raise the rate, it could eat up some of the savings, but your plan would stay exactly the same. We wouldn't have to change plans. But if they raise your rate 5%, 6%, 10%, whatever that percentage is, we'd have to ride out that storm from July till the end of the year. But you would have, that rate would typically hold. Now, I'm not expecting that, but because they've already taken a couple of decent rate increases already. This past year was one that they did. Did you guys have a rate increase in July this past year?
5%.
Yeah, so I'm going off of what they've done on that renewal, but then what they said is that once we get through that July renewal, we'll have a January. And then from that point forward, we'll never have to worry about a mid-year renewal again. It'll actually all tie to the calendar year, and you're typically, again, made aware of that by November 1st. And that's where the last thing I'll mention is that this secondary insurance gives me the freedom to say, okay, you're raising our rate. Let me raise the deductible. Go one level up higher on the deductible because my gap insurance is going to be still a situation where I can leverage that savings. And so that's, again, at least gives us a tool to always have the ability to raise the deductible without hurting the employees. Now, would the gap go up if I have to have them cover a little more? Maybe a little bit, but not that substantial. Not as substantial as a 5% increase that you might get from Blue Cross directly. It gives us a tool.
Additional questions?
Would you mind showing a copy of your card? Oh, actually, before they asked, if you wouldn't mind putting them through, I wanted to let you guys know that we do all of the supplemental type of benefits. But one other thing, and so I didn't bring everything out to discuss all of those things, but what we will typically do is if you really like a plan that you have, we can actually take over the service of that, or we can replace it if we have something that's much better, that gives the employees more for less premium. Are the employees participating in some voluntary products, like whole life insurances, things like that?
Yes.
So one other thing that I was going to mention that I'm excited about is the dental insurance plan. If you guys can flip back to that page, this is, again, another TML product that we were able to leverage the power to buy. And the only column I want to really look at is the Elite Plus. Because if you look, most plans, and I don't know if you guys would know the details on this, but with your current dental plan, do you have $1,000, $1,250, a $1,500 annual benefit?
Alicia, what is?
I think it was 8,000.
about 1,000. That's the most common.
Yes,
Sometimes people will upgrade that, but, you know, I told you that doing $1,000 benefit is kind of what most people will do. What we decided was if we're gonna put the TML brand on it, we wanted to come in with something a little more special for about the same cost in many cases. So, if you look at the Elite Plus, this is the best dental plan we've ever put together. It's got the 100% coverage on preventative, 80/20 on basic, 50/50 on major. It does cover orthodontics, which a lot of plans don't. But what's really exciting about it is the out-of-network coverage. Now, number one, this is the strongest dental network in the country. But if you, I actually was golfing about 3 weeks ago, and I had this dentist that I was playing with, and I said, oh, I got all kinds of customers can ring. He goes, we don't take insurance. So there are more dentists now just saying, I don't want to work with any insurance companies. So what I liked about the way this one was set up, you see where it says out-of-network coverage 90th percentile? That means that they don't consider like out-of-network to be that big of a penalty. They'll still give you 90% of the benefit, even if you go to a dentist that doesn't take anyone's insurance at all. And it's happening. I don't know if they just don't want to work with discounted rates. But I really like that you can go to any dentist and know that you're going to get substantial benefits out of this plan. It does have a $50 deductible, but it's not, that's not subject on the preventative. There's no waiting period. So from the very first day, if you look at the annual max, they give you $3,000 in benefits from the very first day. Now the plan may be $3 or $4 more expensive than some other plans, but because of the TML buying power, it might be the best $3 or $4 that you spend. Because it's now going to get $3,000 in benefits instead of $1,000. And as we look at the cost of crowns and other things that can happen, we like the idea that that's $3,000 per person. But they go one step further as well. If you have young children and someone chips their tooth, or even as an adult, if we get that Jim Carrey smile, Dumb and Dumber, that's something you got to fix right away. So they do an extra $2,000 benefit at 100%, so you can get that fixed. So it's not a percentage of coverage. They cover the accident, the first $2,000 at 100%. You just have a $100 deductible. So that means you can get in, get it fixed. It's not going to cost you in many cases anything. So that's the TNL dental plan. They have 3 different versions. The 1,000 and the 1,250 will be very priced very similar to what you're doing now. But we like the idea of offering the ability for employees to upgrade potentially to that. So we don't have to make a decision that satisfies everybody, but if you offered that, you might find that some of the people over 50, like myself, might like the idea of having a little more substantial coverage for $3 or $4 more per month. What's that?
I don't see prices on
Oh, it's just on the next page.
Is it with vision?
Yeah, so the Elite Plus is $45 for an individual. To do the vision's just kind of boilerplate. The vision's going to be very similar to what you have today. $10
So together, it's a joint coverage.
It's rider. Yeah, if you want the vision, you can choose that. It's not required. So if somebody doesn't really want the vision, they don't have to pay for it. But you can choose to do it as a package or do one on their own. If they don't want the dental, but they like the vision, they can do that on its own too. That's something the benefit counselor talks to them about.
Oh,
But if you guys are sponsoring it now, then you guys could say, we'll sponsor the midpoint plan, or we'll sponsor the 1,000, but let employees choose to upgrade. That's something our benefit counselors would do. And then at the end of an enrollment, we do a complete report for the administrators that builds everything out for the payroll system. So you know exactly what the payroll deductions are. We have a team that does nothing more than make sure all the I's are dotted, T's are crossed before the first payroll is run.
So if I'm looking back at our note from our previous meeting, currently our dental is costing $28.28 a month, and vision is $434. That's
It's about 32.
That's how.
Okay.
Yeah.
So if
That's going to be priced very similar
32,
to the little lower cost plan, which is 1,000. I think that's going to be 27 for dental and vision together. So it might be a little less expensive if you just do the essential, which is probably similar to what you're doing now.
You say $32 extra a month?
just dental alone is 28. Vision is $4.34.
Yeah.
So be $13 extra one.
And it would be something they could choose if they want to pay an extra $2 a paycheck per week or something. $2 per week.
Next some of that too.
Yeah, it's a roller savings from medical over into it.
So that was my hope, is that if we have, some savings on the medical, maybe there are some things you can do that would be a little more special. Maybe a great enhancement to what they're doing with it.
I really like having some of these supplementals as options, because, you know, we have at least one, if not two supplemental insurance people would come by, and it's on the employee to track. A lot of times they don't turn it in.
Right.
Or they get so affected by the paperwork and then don't. So you got one umbrella for most of it, because I think that's all here.
And that's not all
Critical
the problems.
illness, disability, pretty much everything but like a cancer policy that you have for supplemental insurance through one company, and make sure if something happens in an emergency situation, sure there's this, and hey, you got this other benefit here.
That's where our benefit counselors, and what I find a lot of times is that it puts a lot of pressure on the administrators, because the employee may not remember what they bought.
Yeah.
And now it puts pressure on someone to have to go in and try to figure out and call around it. The biggest thing for us is our relationship with the carriers means that if you guys have a question, you call us. We're an extension of your office. So you have almost an additional entire team of HR resources at your fingertips. You guys don't have to remember any of that. All us will.
Can I ask a question?
Sure.
On that, I was just telling Scott, the thing that I worry about is that urgent care increase. Cause is that, what do you consider urgent care? Is that like a fast-paced clinic? Cause I know a lot of people nowadays who will not go to a doctor's office, will go to an urgent care. And our current plan, that's just a copay, like $30, $35. So that's a pretty good increase on that.
I wish there was something I could do with that, because I'm with you. A lot of our plans have closer to those $50 copays. That's a little bit easier to stomach. The one thing I would say is if they do have to pay the $130, it does go towards satisfying the $1,000. So their worst case scenario would be the $1,000 per year. They're at least getting credit towards that. I don't really have a better answer than that for that. I wish I did. Yeah, there's, if you guys wanted to take part of the savings we created, it's not uncommon for you guys to maybe do a small HRA. I just try not to put too many moving parts into it.
Yeah.
What we find is a lot of times people will think they're going to an urgent care center, but a certified urgent care center is what this is really referring to. And there's a difference between a walk-in clinic, like fast pace, that may be treated more like a regular doctor than it is an urgent care center. So that's the one differentiator we would probably talk about with the employees, because urgent care centers are really like mini emergency rooms, and they're usually right next to the hospital. But on every corner, I see walk-in clinics that have the term urgent care out there, but that's more of a doctor's office. And in a lot of cases, that's going to be something that's going to be treated more as an office visit copay, like a walk-in clinic. So I wanted to let you know that urgent care centers are probably not as common as the walk-in clinics that we see on every corner. So when they show their card, I would say that their worst case scenario would be the $130, but it's more than likely going to be treated like a doctor visit. It could be as little as 10, it could be as high as 75. But I'd say that would be how we would guide them. If they say, this is the urgent care center I go to all the time, how would it be treated? That's where the benefit counselor would let them know. This is what it would be. We would find out how they're categorized in our system, whether they're primary, specialist, or truly urgent care.
You have a scenario in a situation where you have an employee visiting a specific place. Can we get an answer from them saying that it's gonna be treated like a doctor's office?
Yeah, so what we normally do as a starting point is we'll look at our system and say, here are the urgent care centers in your area. These are the urgent care centers that are showing up with Blue Cross, and it's however Blue Cross categorizes them. It's not us, it's Blue Cross. So Blue Cross says this is a certified urgent care center, true urgent care center. And if it's a walk-in clinic that takes Blue Cross, my guess is it's going to be more of a doctor visit. So if they're not on the urgent care list, and we would look up that walk-in clinic, if they're showing up as a primary doctor or specialist, we would be able to then see it. Most of them are going to be primary doctors.
So in a situation like that, and say if we were to go with TML on this, would we be able to have a list of that to give to the employees so that they could hopefully keep their little packet together and refer to in the event that they needed to go to a walk-in and be
That's
able to
absolutely a
just
great
go down
idea.
there and like, okay, they're not on an urgent care list, so I know I don't have to come up with this.
And it's
number.
something we would help communicate with you, because we gather all of their contact information during our enrollment. If I wasn't clear on this, we don't do like an employment packet. We talk to every single employee. So that's the difference, I think, between us and some other folks, is that you have 230 people. We're gonna have every single one of them is gonna have an opportunity to speak with us, their wife, whoever needs to be on there.
Is that
We
an
wanna-
in-person meeting or?
It
is
can
that-
be in person or it can be over the phone, whatever's best for the employees. But if we set up an open enrollment date, we're a little, because we're trying for January, the one thing I was going to mention is that this is the busiest time of our season. So if there is a way for you guys to see your way clear one way or the other, I have a team that has a lot of work to do in order to put the enrollment platforms together, kind of do the logistics. And if it's going to be in person, we can do that. It would be something I'd have to make sure is on the schedule, and we work it out to where it's a convenient time for the employees, where we know that they would be able to show up. And if they aren't able to, we can have a window during that end line, but if they aren't able to make that, the virtual is actually still somewhat face-to-face. We do a screen sharing, we open up all the benefits, we just take our time explaining them. So between those two things, we'll get everybody covered, and everybody does have to answer, whether they're waiving or they're signing up. We talk to every single employee.
What kind of timeline do you need, like?
Well,
If I told you I had a call with a gentleman 2 days ago, he's like, yeah, we'll do what you need to, but what are we looking at? And I said, I felt like this was going to be something maybe within the next 5 to 10 business days, you guys would see your way clear on. They'll move a mountain for us, because they also understand the value of the team. So,
on urgent care, I've got the Blue Cross app because that's what we have. The only thing they pull up in Shelbyville that their county is urgent care is fast pace.
It's fast.
okay, good.
Fast pace, yeah. The next closest one they're saying is Ascension St. Thomas in Murfreesboro. So.
You want a job?
I know they urgent or fast.
I'm not counting the names.
Yeah. I kind of have a question on this. Step back.
You didn't raise your hand.
For example, here in town, we've got a Vanderbilt hospital, of course, but on South Main, there's a Vanderbilt clinic and then a Vanderbilt doctor's office. And I'm just wondering, it sounds like that clinic is not considered urgent care. Because when I need my sinus shots and stuff, I just go in there. You can walk in, boom, they shoot you.
Basically, you're gonna have a lower overall out-of-pocket copay if it's not an urgent care and it's more of a doctor's office. It just happens to be an extension of Vanderbilt. That's where you're gonna pay a $10 copay. You aren't gonna pay the $130. Yeah, and so the $130 is really meant, just so you guys know, I wouldn't say people have been abusing the urgent care centers and using them as doctor's offices, but I think that's why some of these copays, we're gonna start seeing those going up over the next few years. I think that they've been almost replacing the doctor's offices. I'm sure doctor's offices aren't thrilled that they're losing so much business to these walk-in clinics, but I would say that if we're looking at what the doctor visit copays would be versus those urgent care centers, the urgent care centers are meant for more serious issues. Maybe not so serious you go in the emergency room, not life or death, but stitches, things like that. That's what urgent care centers are really always meant to be. And it's still a lot less than a $1,000 emergency room visit.
So it's an education thing for our employees to say, hey, let's do this Vanderbilt clinic over fast pace.
Over fast
Basically is what it boils down to.
Well, it's just
Should be
urgent care, starting like a swing.
Yeah.
Where I don't have that.
Yeah.
I know that the $10 copay.
I'll save the $120 and schedule.
So it's not gonna matter that it's called urgent care, because the actual name of it is Vanderbilt Integrated Urgent Care.
It's how
But it's
Blue
not
Cross is,
listed under
Blue
Blue
Cross is,
Blue Cross didn't show it under there.
So
Well,
that's
see,
what
it's,
they're gonna
I think it's an industry slang.
Yeah.
yeah, it's how Blue Cross is gonna categorize it.
Just a little something to muddy the waters.
And we'll, just so you know, I have Kristen taking some notes as well. So we'll look at these in your specific area out here, because most of the employees are services within 10 miles of where we are right now, if I had to guess. So we'll look up all of the walk-in clinics, urgent care centers, to try to get a little bit ahead of those questions before we start fielding those.
One more question that's drawn, and then, so the $75 for the specialist, is that every time you go to a specialist,
It
or
is.
just till you get to $1,000?
No, it's every time you go to the
So that
specialist.
just
So
continues
the
every
only
time.
time that those co-pays would go away is if you actually hit the $10,600 max. So if you get hit by a Mack truck, if you end up in a really terrible situation, your traditional out-of-pocket is the only thing that would eventually take those co-pays away. So we try to let the employees know that your deductible on major medical is treated differently. That's why I separate it out to let them know that these co-pays could continue.
So if you get to your $1,000 deductible, you still have to pay that $75.
You'll still be paying your co-pays, unfortunately. Yeah, that's the way the plan was designed, to try and make sure there was balance to it. There is a supplement that is buying down those co-pays to the 10 and 75 for those doctors and specialists. Would you mind showing the card itself? So this is what the secondary card will look like. If you guys can see the screen, it may not be in your book. But everybody can see the screen. Oh, good, okay. And so we had one other thing that we did refine on it, but it'll have all of the employees, the policy certificate, if they have any dependents, everybody is covered through that. And if you flip it over, there's an 800 number here in bold. This is the 800 number that's always answered by a live person. So if I'm one of your employees and I go in and the doctor says, I don't recognize that, I don't want to work with it, we're just going to ask the employee to ask them to please call that number, and then a Zurich representative will put them at ease that this is the town of Shelbyville program, and this is something that is bad, and this is what we would make sure that they would know that. Now, if they're going to a hospital, the reason that that's important is for the doctor visits and the specialists. If you go to the hospital, just about every hospital is going to ask you if you have secondary insurance. And so that's where that secondary card comes in. When you show both cards, there's no claim forms. Everything's handled by the administration of that hospital. The only time we run into issues is when we're dealing with a doctor's office that doesn't normally get secondary insurance because they're just used to collecting a copay. This is where they'll have an 800 number they can call. There's also an 800 number here for the employee. If they don't remember how something works, that's always answered by a live person in minutes. There's also a little information packet or educational piece we send out with this, so they don't just get the card. They're going to get a little 3-page, a little trifold flyer that's going to walk them through and give them specific examples on how it's meant to work. But they also can call the 800 number for us.
Got some questions? Any questions from the trustee members? Thank you all very much.
It was a pleasure meeting you guys, and yeah, I'll let him. Thank you guys.
Well, we have occupied a lot of your time, but I do want to thank everybody again. When the league board voted to approve moving forward with this program back in March and authorized us to do a beta test, when they saw that it was successful, they fully committed to rolling this out. So as you mentioned, there's strength in numbers, there's strength in association buying power. And my full commitment is to grow this as much as we can, to get as much as we can, so that we are all working together for the benefit of each other and driving down costs. Because right now we're just playing whack-a-mole every year to try to keep a cost down. And if we can get our pool together, if we can get the ability to offer an enhanced benefit every year at a lower cost, just like we're showing today, then I think at the end of the day, we can all lean on our, podiums and say we did a good job. But thank you again for your time. Thank you for your consideration of this, and thank you again for your membership in the Tennessee Municipal League.
One last question, yeah. When's your drop dead deadline that you all would need to have?
I hate to do that to you, but I would say that the soonest that you guys could put this on a committee meeting, the better. It's just it has nothing to do with the effective dates and that. It's just making sure our team is prepared. I've already had them kind of get familiar. We've sent them a lot of the data that we had. I wouldn't say I was overly confident, but we did send them a lot of the data so that they would at least know that your group exists. And I told them we would try to get the green light from you guys as soon as we can.
Our next council meeting is November 13th, so that's like 2 weeks from now. Is that
I would say if that's the best date we can do, we'll make it work on our side as best we can. Yeah. It may mean that we would be doing our enrollment, rather quickly from that.
We could probably, yeah, because the meeting would be the 13th, so then it would be the morning of the 14th. I can give you,
Okay.
or I can call you after the meeting.
Yeah, it's my team. I just want to make sure that, if I told you that they love me sometimes, sometimes they don't, but, we would work Saturdays and Sundays to build out the program.
December, I assume.
He just committed her.
Actually, having fun.
I'm sorry, that's.
You have some extra, like, real brochures, stuff will be with you guys.
Yeah.
One of those for us.
EML and Zurich. Thank you all.
Thank you.
Very
Thank
much.
you.
Thank you so
Much.
I'm gonna leave a quick stack of cards here for you guys, just in case you guys think of a question afterwards. You can call me directly, and I'll be happy to take anyone's call, okay?
Thank you.
Thank you.
Thank you all.
Well, now move us into new business for general discussion. Floor is open.
Like I said earlier, I asked her for the downside, and I don't see one. If anyone else sees one, I'd love to hear it. Cause, I mean, I know we have to weigh all the pros and cons out, but $250,000 savings, and all you have to do is, hold the card in your wallet. What's the downside?
The only downside I see is that it is a new program.
It's changed.
In its infancy, a year or two or three from now. I don't know about my lunch money, there's gonna be cost increase. I can't imagine Zurich or whoever sitting on a number very long without going up with this kind of advantage. So that's the downside I see, but Blue Cross Blue Shield.
They're gonna go up too, though,
They're
right?
Going up in the meantime too, so. I'm hoping we don't see any 20 and 30% increases. But overall, Matt and I were saying it's a no-brainer.
Yeah.
Hopefully.
Well, we are, we're under a time crunch.
I'd like to make a motion that,
But before we entertain the motion, let's have just a little more discussion. In reference to the time crunch, is the committee ready to entertain the motion? And if we're ready to move, or do y'all want more discussion prior to?
I'd like to hear from Josh too.
I mean, I think I'm as skeptical as anybody. I mean, when it looks too good to be true, you're always looking for a downside, but there's not a visible one. I mean, if the rates go up in 1 or 2 years, we're not locked in with them. We go right back to Blue Cross. We're not signing a 3-year, 4-year, 5-year deal. This is year to year. So take advantage of it for a year, try it out. If it sucks, we go right back the other direction.
it's still Blue Cross.
Yeah.
It's still Blue Cross. It's still Blue Cross. It's just the gap.
It's the gap.
It's the area. So.
I want to bring up something too. We've got about 25 people that I feel are in limbo right now. We have the housing authority and the library that are under ours. Of course, their claims, they affect us. What do we do with them? Do we know what we want to do with them? They need to know if they need to find other insurance, or are they going to be factored into ours?
I would expect they would stay with us for about to save the money and get a better coverage, what more.
Yes, I mean, as long as we know.
The only other question I do have, honest to goodness, is the dental and the vision. Now, I understand that the TML is more expensive, but if they're saving $250,000, the city's saving $250,000 on the medical, would the council be willing to roll in that savings into extra dental and vision for its employees?
I think it's a general concept. Yeah, I mean, we need to run the numbers and see what that is. Make sure we don't need it all up, but I didn't do the math yet, but I mean, it would make sense. Yeah.
You run quick numbers?
I think, in my head, I think we're looking at $20 a month from
Yes.
for going what we currently have, up to the Elite Plus with the Vision add-on.
Correct.
That was just a quick, in my head, number.
What do we pay right now on the dental? Just the individual coverage?
Individual vision and dental,
And then the employee pays for any buyer?
yes,
Yes.
the complete cost of.
They pay 100% on dental.
Give me a minute, I'll have the exact.
I think also looking at, of course, TML's taking the risk, or Zurich's taking the risk for us for that part of the insurance. But if you look at the employees' benefits feedback, the number one thing that the employees voted on was the deductible, which this insurance would tremendously reduce the deductible. Then the second thing that they was co-pays. It'll help the co-pays except for the specialists, right, the specialists. And then the third thing was the weekly premium rates, which is gonna affect that also tremendously, so.
I didn't tell everybody, this was, the employee benefits
Yeah, that was a
results. We had a pretty good, I would say, a pretty good turnout.
Oh, it's here. That's close.
Okay.
That difference between what the city's paying right now for dental and vision, it's $32.62 a month. For the Elite Plus, you're, looking at $19.38 a month more.
That's exactly what I came up with.
Other employee.
So even if we stayed with their essential, it would be less.
How many employees do we have?
210, I think is the number we're
Yes.
working on. Yeah, I'm coming up with about a $50,000 increase, give or take, and I don't think that's unreasonable.
No.
Considering how much we're saving.
$4,000.
That's what I,
Did you do it times 12 months?
no.
Oh, yeah.
1938.
Sorry.
It-
48,000
Yeah, so about 50, yeah.
out of our 260.
Out of our, yeah, it's just-
Which seems great, right? Still
Yeah.
$200,000
It's
savings.
still a savings, and you're getting better
Yeah.
dental insurance too, so.
Did you run are those the numbers for the,
Correct.
still?
Correct.
Would you think that, with the remainder of what the savings is, the whole point that we're doing this is savings, but I also think about job recruitment. I think about the employees that we do have right now. With the remainder of the savings, would we try to bring down the weekly cost that's going to the employee with spouse, employee with family, lowering those, weekly with the savings? I mean, if we hit zero and have a better recruiting tool and more satisfaction from the employees, I still think it's a win to the city.
Were the numbers that you ran, the 50,000, was that for the?
That was the top level.
That was the
Yes.
top, that was the only question.
Top
Yeah.
level.
Hey, are we ready to move on?
I think, yeah, I'm ready. I just think clarify that I think we need to, if a motion's made, is that we make a motion that we're gonna take this as an insurance plan and then have staff continue to work on it to present as far as the dental and the vision, what the best courses or option are for the city manager, benefits, whoever, to council. Like this in general, we were talking about this main plan and the best course or best couple of courses of action for the council to take on the savings and how that applies to the dental vision. Because I mean, I would tell you, I just spent 14 grand on braces. And I think it was, of course, I got twins, but I think we had 1,000 max or 2,000 max total orthodontics. I mean, just that alone, paid for me for the whole year.
Actually, I think it does have a max though.
If
You look at
I know it's twice
Yeah.
of what our max or what we're
What
at.
we currently have.
Yeah,
What's your max?
that I just got the plan for. This is like twice as good.
Got down here at the bottom, it's orthodontic services, annual maximum $1,000, applies to members up to 19 years of age.
So, but I'm like, so I guess just the best way to word that motion, I mean, I have to make a motion. Well, somebody, it's more articulate. I just think we need to make a motion
To get the final.
to find, to get the details, so council has something that's very non-hypothetical to debate on.
So I suppose what you're all thinking about doing is making a recommendation to council. Is it your intention as a committee, though, you've basically heard from three main groups. Are you going to break down the numbers comparison to all three to show council, here's kind of why this is our recommendation, here are the reasons why we make this recommendation? Because council can, I don't know if they're going to be asking you a lot of questions about why you decided to do this, what your numbers are.
That they created the committee to come back with a recommendation. And I mean, that's just my fault. I'm not, if we come back and say, we interviewed different people and we satisfied our desire to do so, and we feel the best plan is this, and it's this much savings, and we can take these savings and do these couple things to help augment to what we're already doing. I mean, I think we've spent a lot of hours going through the numbers to get that recommendation.
I don't want to spend a lot of time creating, causing staff to have to get the minutia of each one of our presentations that we spent months doing, or weeks basically over the last couple of months, every week. That some are gonna have questions. Sorry, but it's reality. It doesn't matter how much you put in, how much paper you put in front of them, they're not gonna read it or understand it until they see what the recommendation is. So with this committee, and I'm agreeing with Matt or seconding his motion, that we recommend to go with this plan and that the savings of this plan be listed as possible alternatives to improve the benefits of spouse and family coverage, which we're already covering 50%, we might be able to do better. And go with including our recommendation, that we go with the elite plus dental vision. Be it concise enough.
Yes, sir. I second that. So
Whoever wants to make the motion, whoever wants to say it.
Can I third it? Is there a third?
You do have a motion in effect. Lisa, do you want to restate it?
Yes, as I get it figured out.
With the motion.
Motion to recommend to council to take the TML recommended medical plan with the Zurich gap. And, I don't need to fine tune anymore because you said, and include the Elite Plus Vision and Dental Plan to, hang on, include the Elite Plus Vision and Dental Plan and take any possible savings, or take the savings
Should be about 210,000.
to help, what did you say?
Offset.
To, was it?
Give alternatives for those savings to cover family and spouse coverage, additional coverage, if you want to do that. I'd like to see what those numbers are.
Okay, I got it. To offset the employee cost of family, spouse and family coverage. How's that sound? I'll read it again.
I like this. Thank you, Scott. And this is why TMA is such an important trip every year.
We wouldn't have known about that had we not met at a conference.
Yeah.
He was digging and we were there to dig at the right place at the right time to get on to something that this could be really beneficial for a lot of people.
Lisa, if I may, just add into that motion that this is with the FMIG agency.
Are you saying offset all of the cost to the family plan or some of it?
He wants alternatives.
The what?
Right now, we do 50%.
Yes.
I would suggest putting 75% and 100%, see what those totals are. I'd like to see that.
Does anybody remember what the deductible was on the state plan? I don't.
1,500, I think.
That's really
Let's see. That's part of it.
Yeah.
That was the other big pool of people. I just didn't know.
And they had the
They
different,
had different levels. Yeah, their limited one was 2,400.
Yeah.
And then they had 2,000, and the other one was like 750, I think, for their super.
Okay.
Before we have further discussion, let's restate the motion. Then we'll open the floor for discussion.
Okay, the first made by Matt, seconded by Councilmember Feldhouse, a motion to recommend to the council to take the TML FMIG insurance medical plan with Zurich Gap Insurance and the Vision Elite Plus, Vision and Dental Elite Plus plan, and to recommend that any possible saving or any savings be used to offset the employee cost of spouse and family coverage.
do you need to add child in there since
Employee, spouse, child, and family.
because it's broken up that way in three different?
Whatever
We have-
the current options are.
Chief, Councilman, is that your motion?
Yes, it is.
Now we'll open for discussion. If there's no discussion, Lisa, will you please call up?
Councilmember Blevins,
Yes.
Member Marlowe,
Yes.
Member Frieden,
Yes.
Member Claxton,
Yes.
Member Valad,
Yes.
Member Doe,
Yes.
Councilmember Feldhouse.
Motion is passed.
So that'll be added to the study session agenda and then to the November council meeting.
Any further business of the committee at this time? If not, I hear a motion to adjourn.
Just, we should see the options before that, before it goes to the study session. You think that the numbers, you'll have the numbers and everything that we.
I don't know who's doing the numbers. I guess somebody will.
Oh, yeah.
It needs to be a committee member or me, at least.
I think you guys are the only ones.
Tomorrow.
If you can, and
I didn't know if it was a committee or
She's talking about you.
definitely.
Any other discussion?
Well, yeah.
We have a motion to adjourn.
Motion.
Second.
Second.
Nathan adjourned.